Hello, and welcome to this week's episode of Ladies, Let's Talk About It. I'm your host, Dr. Denise Jagru. I'm a board certified clinical specialist in women's health physical therapy. In today's episode, we're talking about gender disparity in healthcare. That sounds very serious, but what it means is women do not get the same level of care in healthcare as men. And it is fact, and it has been researched and studied, and it is true. And today, to help me talk about this topic is my friend, Kiara Jones. And I just want to start by saying I'm in always constant awe of you. I always admire you. You're an amazing woman. She is a filmmaker. And I'm so honored to have you here to talk about this today.
Thank you. Thank you for having me.
Yes, I'm so honored. Thank you. So at first, I just wanted to start with a story about why maybe throughout history, women have had a hard time getting the same level of care as men. So in ancient, this is a true story, by the way, in ancient Greece and Egypt, it was believed that women suffered from hysteria, and only women suffered from hysteria. And, hysteria is exaggerated emotional behavior. And so they believed that this happened because women's uterus roamed around the body. It was called roaming uterus. And so it put pressure on different structures that caused the woman to have hysteria. And the only way you could heal it, or one of the only ways, is to put good smells near the vagina. So that's how you could coax the uterus back into place. And then also sex, of course. So like only a man could heal it as well. And it was so ridiculous, but it sounds like nonsense. However, hysteria was only removed from the Diagnostic and Statistical Manual of Mental Disorders in, guess what year?
In the 1900s?
1980. Who remembers 1980? I mean, it's crazy. This is so recent. And so the idea that women suffered from something that caused them, emotional exaggeration of their symptoms and the behavior. And this has peppered, people's perspective over the years. And it's been an official diagnosis until recently, until our lifetime. That is insane.
I mean, it kind of speaks to the psychosis of the medical profession. No disrespect to any of the doctors out there, especially this one. But, we are trained in society that male doctors are more knowledgeable. Like we are just now being introduced to the idea of women doctors as specialists and as experts in their fields and that sort of thing. And the studies have been of men and male bodies.
Yes.
And, we know the horrific stories of the way we got to the knowledge that we currently have of women's bodies, which was through some pretty inhumane processes, a lot done on Black and brown women across the globe, actually. And so the information, I am astounded daily on the information that I discover about women's bodies in medicine, having had one my entire life, having actually had a specimen of my own to consider. Like the internet, and as much as I complain about social media and, all the stuff that's out there, there's so much information that's being disseminated through these channels that it's just I'm still going oh my gosh, oh, that's what that is? Oh, that could be the possibility. So it puts us in a really challenging place, especially when we start talking about the many phases of femininity that a woman goes through in her life's journey and dealing with medicine, and being able to trust that the medical professionals that you're going to seek help from actually have a true understanding of what's happening with your body. It's like a planet is being discovered daily in the women's in women's health.
Yeah.
I mean, at least that's how it feels to me, because what I remember learning in health in high school, you know what I mean? Totally different world now, entirely different universe. And I think it's important for us to take as women, to take a proactive stance on learning and, dare I say, questioning, even though I don't want to upset the medical professionals, but, challenging or questioning or being more aware of the possibility that the information that you get may not be accurate just because it may not be the latest
Mhm.
knowledge that's
Mhm.
available. Like, we
Mhm.
just got all this hormonal treatment therapy
Oh,
information that just got disseminated. It was
yeah.
just like,
Yeah.
"Oh, wow." All of
Mhm.
you think when you go to the doctor, you assume that they know it, and if they had it available, it would have been given to you.
Mhm.
And
Mhm.
honestly, my feeling is that may not be true.
And let me make a comment about that, the new information we got about this hormone therapy, which is so crazy. And the history behind it is there was a study done 20 years ago about the effects of estrogen and hormone replacement therapy, and it was very poorly done. And the subjects that they had, they did not qualify really for it. They were like way postmenopausal, and they were already at risk for cancer. So to develop cancer, but they were already like at risk. So the media, like the message that came from that study was that hormone replacement therapy for menopausal women caused cancer. And I remember growing up thinking that, and I was always so scared of it. Whereas there are very safe like ways to administer estrogen to help women with perimenopausal and menopausal symptoms. And you could have it, in the lowest therapeutic dose, like through either creams or ointments, like in certain areas, depending on your symptoms, or like through a dermal patch. So you have like the most safe absorption into the system. And like doctors have been fighting for 20 years to try to get this message out. And they finally removed the black box
Yes, the black box labeling.
warning, saying that like, it can cause cancer. And then this took so long. So many women have suffered for the past 20 years without getting some relief of their symptoms because of this erroneous information that was like pumped out into the media 20 years ago. So, a lot of the information, like you said, we're not getting is correct. And I read this article about even medical textbooks and how medical students are more confident, like diagnosing and treating male patients because even the images in medical textbooks are of
Yes.
men and not of women. And so, just in general, like in medical research has traditionally been done on men because of the cyclical changes in hormone that women experience with their cycles and like during the childbearing years, like how, if someone got pregnant, it would disrupt a study. So they've traditionally researched men, but then the medicines, the medications, the dosages, everything has been tailored to men. And this
Right,
is,
they do the research on men, but then they give the product to women,
right.
which doesn't like, medically, it doesn't even make sense. It doesn't
Exactly.
make sense to do that way.
Exactly. And this is not something like I'm talking about long ago. This is like current times, and even understanding that, when you're thinking about these conditions and researching whatever, like men and women just present very differently. Like you need studies just on women.
Well, even
Right?
women and women present differently, right?
Yeah.
I've been told my whole life my uterus is upside down. It's like I prolapse, or I don't know. It doesn't go the way the pictures in the book go. But when I would ask the doctors, well, what does that mean? They would go, oh, nothing. It has to mean something. It
Hmm.
has to mean something. It's if 90% of women go one way and mine goes the other way, it's got to change something, or what? But because they don't have enough knowledge, they just it's just a note that they put in the file,
Hmm. Hmm.
which could very well have had something to do with why I had such a traumatic birth. I had a very traumatic birth when
Yes.
my son was delivered. I don't know. They don't know. But this is where, so we're talking about the idea that studies that were defined for women were being done on men, and then the product was being given to women. But then you also don't have the expansion of exploring between different women
Hmm.
and
Hmm.
different women's reality and their anatomy,
Hmm.
what
Hmm.
what that could be, what that could
Hmm.
mean,
Hmm.
because we just don't have the information there yet.
Hmm.
Um,
And what's promoted so much is just like how a male would clinically present with something. Because I think a lot of people don't know that women, when they present with a heart attack, symptoms of a heart attack, it presents like indigestion,
mhm.
right? And I knew this firsthand because over the summer I had terrible abdominal pain, and it was like 20 out of 10 pain. It was debilitating, and it wasn't in my chest. I wasn't grabbing, my left arm like what you would imagine a man would do, right? And because that's how they would present. I was having abdominal pain, and I went to the ER. and I was throwing up. And the first thing she did was an EKG, and she's like, "I need to check something." And I said, "You think I'm having a heart attack, right?" And she's like, "Yeah, we just need to clear you." And it was like through this whole episode, and a little bit before that, I was learning really like that women put off their symptoms because not that I want to make everyone think that if they're having a little bit of indigestion that they're having a heart attack, but the idea that like it just doesn't present the same, and women are just like, I'll get it checked out later, when in fact they could be having a heart attack. And
Right.
so the clinical presentation of women doesn't always get promoted, because what I grew up, imagining is like, when you're having a heart attack, you like men collapse on the floor and they
Right.
have like,
Pain in the left shoulder, pain in the side of the neck.
Right. Right.
The jaw, all of that.
Yeah. And you could have none of that as a woman if you're presenting with a heart attack, which is very scary, but that's not what's presented.
So then the question is, how do we
Right.
combat that without being disrespectful to those who have studied in the medical? Like, I understand this when I'm talking to my doctors. Like, I'm talking to you about the thing that's happening to me. You've studied this for years, but I've come to a place where I realize now I live in my body. So if I feel like I'm not being listened to, I'm not being considered, if they're not pronouncing my name properly, like it's kind of like, and I work in film and television. There's this old green room conversation they have about like, oh, Mariah Carey wants white carpet and she wants only the green M&Ms and da 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 da, and act like she's such a diva. But the reality is, like, she's asking for this. It's a piece of paper that's going to go to the crew that's going to take care of you the entire time you're there, and by her walking into the dressing room and people taking note of the things that she's requested, she also knows that her rigging is probably right, the lights are probably right, her microphone is probably right. You know what I mean? So it's like, if you go into the doctor's office and they're like dismissing things, they're not listening to the symptoms, they're not asking the right questions, they're not pronouncing your name right, they're not taking you into consideration, like, I feel like that's my immediate red flag to like, I gotta sit up and I gotta pay attention, because I came here for a reason, and I want to make sure that I'm being treated physically and mentally, because like the whole hysteria thing that you started with, it's the idea. And it's always funny to me, because I always remember that because hysterectomy, right? So what do? They pull all of the womanhood out of you. Yeah. That's the removal of womanhood, is a hysterectomy. And hysteria is like the idea that women don't have mental consciousness or exaggerated mental hyperactivity. I just, when I go into the doctor's office, I try to start from a place where I'm making sure that they're actually trying to care for the me, this me right here, right now. Not necessarily some woman you read about in a book,
right?
Or so like, I'm here right now and I'm telling you, this is what I'm experiencing.
And this is a step that you've taken that a lot of women don't take, because 30% of women don't even seek help for conditions that they're experiencing, right? So either they get to a doctor too late, or, they don't make themselves a priority, right? I can't tell you how many women I see, and it's like they've been suffering with something for so long. And I say, like, why did it take you so long? And it's always like, I was waiting for kitchen renovations to be done. Or like, I know I'll see people in January and they'll say, like, I just wanted to get through the holidays. Like, just prioritize everything but themselves. And if I can tell women one thing, it's, it's okay to put yourself first. You are worthy. It is okay to prioritize yourself and your health. There's so many women walking around with like something, like some click in their hip, or like something that they're feeling, and they're like, I'll take care of it later. And I think it's also from society dismissing them so much, right? And just being like, oh, you're making too much of a big deal. So, I think like even just getting women to the doctor is, a whole mission in and of itself.
And there are a lot of things that are real problems for women that they have decided are not problems.
Right.
Like incontinence. There's like a whole list of things that women are they're just living with. Heavy bleeding, periods that are incapacitating, where you have cramping that makes you have to call out from work. They just like write it off as some kind of feminine problem. And then you're not actually getting a treatment for it. You're getting like a different pad, or something that's mitigating the situation, but not actually treating the problem.
Mm-hmm. I mean, I have patients tell me that the GYN, the OB, told them like, "Oh, you had kids. Of course, you're going to be leaking." And I'm like, "No, just because something is common doesn't mean that it's normal, right? We can treat this. This is muscles. I mean, I'm a pelvic floor specialist, so like pelvic floor is my jam. I can talk about this all day, but like you can fix this." And so many women are just walking around like, "Well, if I've had kids, like, of course I pee when I sneeze." No, we can fix it. And I feel like doctors are even telling patients like, that's normal. It's not. And there's so many different ways to fix that now.
And it's just, the more we have these platforms that have these conversations, and doctors like you who are willing to like open up the books and have candid conversations with patients about what's really going on. It's the only way we're going to get to the truth, I think, of what is possible for us as women. I was having this thought that, because I have a lot of friends who are sort of aging out of the childbirth years, and per medical terms, I had a geriatric pregnancy, which I hate that term. I think is a terrible term. They should get rid of it. And then I was like, so what's the timeline? Like in reality, they're basically saying there's about 10 to 12 years where you are good to have a baby.
Yes.
Can you imagine a woman, like you're a woman, you're going to probably live 80 to 100 years in a good life. And of that time, the medical profession is saying there's like maybe 12, maybe 15-year window that you're viable to have a child. Does that seem like so ridiculous? You know, because I feel like I could have a baby right now. As a matter of fact, ask my husband. He will tell you, stay away from her. She's looking kind of shiny. You know, like, so the way the medical profession starts to treat you,
100%,
because it's unfamiliar. I feel like because it's unfamiliar for them. I feel like because it's not something that they're comfortable with being responsible for. So they begin to treat you like you're some kind of a very fragile person. And now the knowledge, this is all this knowledge, the knowledge that I'm getting now about how important the male is in the development of the womb and the and fetal viability and all this sort of thing. For all of my women friends who have had problems conceiving and blamed themselves into therapy over not being able to hold the baby, losing the baby, And now the truths are coming out about how much the male sperm has to do with the development of the womb and the viability of the fetus. Like, it's like we carry so much on us that is, if we had proper medical information, if we had care that was more balanced and more fair on both sides, we wouldn't be traumatized the way we are about our ability to procreate. I think it's very unfair, and I'm happy that this new information is coming out. And like every time I see one of these articles, I'm like sending it to my girlfriends to just to free them from the burden of feeling like I couldn't have the baby. You know, oh, his sperm was fine, it was me. And then the motility rate on sperm is like 20%, I think it has. Okay, here's some information. When they test men's sperm to say whether or not the sperm's viable, they only have to be like 20% good for them to say the man is good. 20%.
That's crazy.
I mean, can you imagine if your car was only 20% working? Or, you know what I'm saying? Like, it's trying. That sperm got to go somewhere. They got a job to do. And you're saying you're giving them a green light at a 20% motility rate? Like,
I mean, besides the fact that like fertility, like journey, and I was on a fertility journey for, 5 years by myself, like it is emotional, there's just high highs and low lows of, when you're trying to conceive. So when you're taking on all that pressure, right, and you think it's yourself, and there's a million factors that have to come together and be perfect. Like we are all miracles. Like you are.
I'm a miracle. You are a miracle. Our children are miracles.
Right. Right. There are a million things that have to go right, but we just take it on so much that we did something wrong. We're a failure. There's so many things that.
And so many things that end up on the woman's side, because on the other side of that, we have like success, it's almost like survivor's guilt. Like now that I have a child, there's like a survivor's guilt like that I have about having been able to do it when I know I have friends that have not been able to do it or struggled years, and they had one and they were trying for another one, and they did, you know what I mean?
Yeah.
And so like there's so many things that get pressured on our shoulders that aren't being considered in the conversation about our health.
Yeah.
Because it weighs on you. All of these things weigh on you. When I had my traumatic birth, because I survived and my son survived, nobody cared.
Right. I know.
Nobody cared, which is very traumatic, because something went terribly, terribly wrong. Yeah. And there should have been medical conversations about it, and at least in helping me to understand what the possibilities might be for me in the future.
Yeah.
But it was really just like, if you ever want to have another baby, you have to have a cesarean section, and we don't want to talk about it. You're done. Which is very dismissive.
Agreed. And I feel like there's messaging everywhere, right? Like even in the health product industry, like is it in like contradiction to like what they say to men about, their products. So one really interesting fact is period product makers did not use period blood to test their products until 2023, right? This is 2 years ago. What were they using? Saline and water, which is not the same consistency.
Does not have the viscosity.
Right. And it so obviously the product is going to be affected by different, the decreased viscosity of water and saline. So it's not going to have the same like absorption, right, than like period blood would be. So like it's not even accurate or correct, And then in certain states, and I have it here, 18 states have a tampon tax, like a luxury tax on period products because they consider it a luxury item. Also, there's something called a pink tax. It's not a real tax, but in certain states, or just in general, the same exact health products are marketed to women at a higher price.
Yes.
Than
razor
to men.
Blades,
shampoo,
deodorant, shampoo, body wash.
Things. Right. And what is that saying, right? I mean, first of all, if you were testing a male product, with whatever male parts or whatever, like they would use the correct thing, right? Like they wouldn't skimp on some. I mean, yeah, one would hope. But I mean, it's crazy that they would spend decades. I mean, this is just so recently that they would even think to use actual period blood, to test their products, which is all about absorption, right? And if you are trying to work with a doctor about like, how many pads are you going through, whatever, it's, if you're talking about saline or water, it's different, right? Like it's just totally different absorption. So I think it's just been such a disservice to women for all these years and all this messaging that we're getting from, health product industry and research just over the years.
There's just so much knowledge about, and then we're not even going to touch the holistic elements that can come into play. The solution medically has been some type of surgery, some type of surgical intervention, and my feeling is with women's bodies, that's like the most dramatic, drastic, unnecessary. Like if there's anything you can do other than go in there. My body has been most happy when nobody's in there bothering anything.
Right.
Like don't go bothering in there. Whenever doctors get in there and start poking around, it gets very unhappy. Even an annual exam, the idea that we don't have to do pap smears annually anymore. Like when they told me I didn't have to have a pap smear, I was like, how is this possible? I've been having pap smears every year of my life since I was 18 years old. Now all of a sudden, no, we don't. You can do it every, 3 years now, they say, I believe. And it's just because the studies have now shown that the cancers don't grow that quickly, and once they've established that you're not having any other symptomatic problems or you don't have a family history, it's just not necessary to go in there and scrape and tear and snip and cut. I mean, when I think of the procedures that have been done to me to check if things were okay, God bless it, it's been okay. But still, that's a lot of damage, and healing.
Yes, that's for sure.
and the body remembers the trauma of it.
Do you feel as a female veteran that you've had different level of care than like, say, male veterans?
Well, veterans care is a whole nother story altogether. But I feel that...
I mean, I can say that as a health practitioner in the VA system, like we only recently, I want to say like maybe the past 10, 15 years, even had a women's veterans health initiative to create spaces where women veterans felt safe to wait in a waiting room.
I can definitely tell you, being abroad and being in the field, I mean, there were a lot of male doctors that were generally taking care of men. I have been in the doctor's office and had symptoms and sat with the doctor when he opened the big book, and we sat and went through and read the thing together. And he's like, "Does this look like what you have?" And I'm like, "That kind of sounds like it could be that." So we're like flipping the pages to find out, okay, well, how do we treat it? Like, we're learning these things together. So, I mean, that's an actual experience that happened. But you know, I can also say that I've been in some situations where they tried really hard to get things right. But on the other side, I know friends who suffered tremendously with fibroids and problems that were ignored, that were dismissed, that were until they became like you have to get sent back to the United States for treatment kind of a situation, because either the doctor didn't have, I don't know why. You can't ever say why. The doctor didn't have knowledge, or they didn't have the ability to treat or whatever. But definitely problems were exacerbated by the fact that they were in a space where they didn't have access to proper care.
Yeah, I mean, in my hospital, I did a whole project just canvassing female veterans about like why this was specifically about like military sexual trauma and like why they didn't report, like why don't they talk about things with their doctor. And, you know, one of the things is, and I see this a ton in my hospital, is the patient is behind them and they're typing on the computer with their back to them. And the patient would say to me, like, why would I even like report anything if you're not even looking at me, right? You're not looking at me. You don't care, right?
That goes with exactly to where we were in the beginning of the conversation. Are you pronouncing my name right? Do you know who I am sitting in front of you? Have you taken any consideration to the actual human being who's here in the room?
Right. And I've asked the clinicians, I'll say like, you know, what do you say to the patient who says like, you know, you don't care? And they would say like, well, I'm busy, you know, like we just have a really backed up clinic. I don't have time to go through like all the questions, whatever. And then I asked the patient, I said, what would you say to the clinician that says I'm busy? And they all said the same thing. Just act like you care. Like, just give me a questionnaire that asks me like just say, how's your day? And like, they just want to feel that you're listening, you know, and that is something they don't feel is even like a courtesy that they're given. So they're not going to report something, I mean, especially as deep as like military sexual trauma, but like even talking about their other issues, you know, they don't want to report it because they're like, who cares? This person is not even looking at me, you know? To
your point earlier of women not taking time out for themselves and taking care of themselves. If I could say anything to women, I would say, if you're going to go to the doctor once a year, make sure that you take that like your spa day. It is so important. Make sure you write down the things you want to talk to the doctor about. Make sure that those things are addressed while you're there. Because what will happen is you'll go in, you get some kind of mistreatment, or maybe you get brushed off, or maybe it's a busy day for them. And then it's going to be another year before you give yourself the opportunity to go back to the doctor. Because I don't go to the doctor. I want to see you as much as I enjoy seeing you as a human being, as a practitioner. Like, the journey to the doctor's office is like, I have so many other things to do, you know? So when you are giving yourself that time, just take it fully and embrace it, and know that this is your moment to get the care that you need, and rationalize that you're not going to do this every day. This is not going to be something, you know, if you miss it today, when you come back, it could be a real problem because you didn't make the time for yourself. We have to be proactive about our own care. It's just the reality of where the world is right now. I always tell patients, like, especially my female patients, you have to take charge of your health. I always say you are worthy, putting yourself first, prioritizing your health. And then I give these couple little tips about how you can
take charge of your health. I always say, just write things down, because I can't tell you how many times, I'm treating them for physical therapy. They're waiting months to see a doctor. They go see the doctor and they're like, I forgot to ask the question that they were waiting, because they felt so rushed and they felt that the doctor didn't have time for them. And so they weren't asking the big question that they were waiting for. So I would say, like, write it down. If you can't remember, take a friend, have them write it down, and then write down what the doctor says back to you, or have them print out whatever it is, like medication, supplements, instructions, because patients always say, like, the doctor told me to take blah, 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 blah. Like, I don't remember what he said and it didn't make sense to me. Like, well, write it down, have them print it out or something like that. And also, if you're not agreeing with the doctor, or you just feel like, how you said, your body, you're in your body, like, get a second opinion, because I've been told so many times it's all in your head, right? And it was, like endometriosis. It was like different conditions that don't have a positive or negative test. And not everything's going to show up positive or negative. And you know how you feel. And so if you feel like you're being dismissed, you go somewhere else. You can cheat on your doctor. People are very loyal to their doctors. No, cheat on your doctor. Get a second opinion. It is okay, and that's another way to put yourself first. Mm-hmm.
I'll give you just one story example. I have a lung issue from being in the service.
Mm-hmm.
I have a breathing problem, and I was having this cough that was so, it was debilitating. It was debilitating.
Right.
It was just coughing and coughing, and I couldn't stop. And I had gone to the doctors, and they checked my lungs, and they checked this and they checked that. And one day I ended up in the quick care, and the doctor ordered me like a Prilosec for indigestion. And when I went back to my regular doctor, I was still coughing because, whatever. They gave me the, breathing thing or whatever. But I went back to my regular doctor, and she was like, well, how did the Prilosec help? And I was like, I never took it because I really didn't have indigestion. And she's like, I think the doctor gave you that to help with your cough. And I was like, what does that have to do? What does one have to do with the other?
Mm-hmm.
I didn't realize the heartburn was backing up into my throat, which was irritating my throat, which was causing the cough, which was irritating my lungs, because once I start coughing, I can't stop coughing. So because the doctor never said to me, I'm giving you this Prilosec, this heartburn medication to help you with the cough, I thought they were just like treating something that they thought might be a problem. You know what I mean? And I never took it. Took the medication, changed everything. Yeah. Changed everything. I was like, I felt so bad, because I'm like, they gave it to me, but I didn't understand this with it. I stopped eating, like the heartburn foods, you know what I mean? I stopped eating spicy foods, and I thought that was going to be whatever that was that they were trying to treat me for. But it really was dealing with this cough that was the whole reason I came in. So what you said about making sure that the doctor explains to you what they're giving you the medication for and what they hope that it's going to treat. Because had I had that understanding, I would have gone about this a different way, because I'm also not a medication person. I don't want to be one of those people who's on pills. If there's something I can do externally to help support my health, I always want to try that first. But yeah, it's like, I feel like there's a lot of flying blind that's going on in women's health, unfortunately. And it's going to take some time, and it's going to take, God bless, more women being in the medical field, and actually taking, and women taking charge of their own health care for us to advance.
There's a lot of steps, a lot of things. But I appreciate you being here.
Absolutely. I appreciate you.
Yes, thank you. I love this conversation that we had, because I think there's just so many different aspects of it that people just don't think about. And women are not putting themselves first, and they're not making themselves a priority. And there's just so many disparities in healthcare in general that we need to, make it our mission to combat. So thank you so much for discussing this with us today.
Thank you for holding space for women.
Oh, thank you. Thank you. You're most welcome. All right. Well, that's it for this episode this week of Ladies Let's Talk About It. Join me next week when we'll have a new episode about another women's health topic. Thanks for joining.